It's a pleasure to be with everybody today to talk about the public health impacts of drinking water contaminants. In Iowa and in many other places around the country, there's been a lot of debate on water quality. Some of the problems we face in the Midwest are related to agricultural inputs, and the discussion has been kind of centered on who's to blame, what's it going to cost to fix it, and things along that nature. So we thought it was time to really get a public health perspective into that discussion, which is what I'll be talking about today. So from the public health perspective, there are some long-standing issues, things like nutrients, particularly nitrate. In the Midwest, we use a lot of atrazine. We're concerned about that with respect to drinking water contamination. Of course, disinfection byproducts from treatment of mainly surface waters, but also groundwater. And we have a lot of data on trihalomethanes and haloacetic acids that we can analyze. Some emerging issues are things like arsenic, naturally occurring, the harmful algal blooms that have become a really major concern in the past few years, things like Microcystin and other cyanobacteria, the new use insecticides in the Neonicotinoid class, and some pharmaceutical and personal care products. I want to be talking mostly about drinking water issues, but also touch on recreational water use and what some of the problems are there. So what we do at our center here at the University of Iowa is we look at drinking water contaminants. We do exposure assessment on those contaminants, and we link that information to health effects data that we have from registries that we keep here at the UI. So the questions we touch on, we talk about, we want to answer are, is there biological plausibility? For example, if we've got contaminant X, how does contaminant X, when it gets into the human body, how does it work in the body that might be a problem with respect to health? Next question would be, what about other risk factors? You know, when we're talking about any type of disease, let's say cancer, lung cancer, well, are you a smoker? You know, other things like lifestyle factors. Do you have a high-fat or a low-fat diet? Do you drink alcohol? How much do you drink? Do you get exercise? All these kinds of things are looked at, and also along with occupational exposures and genetics that are potential risk factors for any disease that we study. For drinking water, we would like to know about consumption data. You know, how many glasses of water do you drink per day? Do you use tap water to make your coffee? Do you use tap water to make your juice that you mix with frozen concentrate? How much do you drink at home? How much do you drink at work? All that type of thing comes into play when we're doing the analyses. And then finally, when you find a result, are there other studies that corroborate your findings? So I'm going to talk about some of the research that's been done in Iowa. We have a lot of resources in Iowa that we use for this research. University of Iowa has health registries, population-based health registries for cancer and birth defects, with information that goes back many decades, actually, with data on, you know, what kind of cancer you might have, when was it diagnosed, what's the extent of the disease, all that type of thing, what your survival has been. Same with birth defects. At our center, we have data on water quality database, water quality data, Iowa public water system data, and private drinking water wells for all the public water systems dating back through the 1960s. We have water quality data back through the 60s. And we have about maybe 1,500 private drinking water wells in our database. The collaborative relationships that go into this type of research, the State Hygienic Laboratory, which is Iowa's public health laboratory, UI College of Public Health. Of course, county health departments are heavily involved in this research. They're the ones that go out and sample the private wells and that work with the citizens, residents of the communities and that type of thing that we work with. State agencies, the Department of Natural Resources, Iowa Department of Public Health, National Institutes of Health. We work closely with the National Cancer Institute, Centers for Disease Control. U.S. Geological Survey has been involved in some of the studies that we've done. The Iowa Drinking Water Utilities, and of course the people of Iowa have been fabulous for these types of research projects. So let's talk about nitrate. And the first thing I'd like to do is talk about the biological plausibility of why nitrate is of interest in the human body. Now, the discussion with water quality in Iowa that has focused on nitrate to this point in time has been talking about blue baby syndrome or methemoglobinemia, which is rarely seen and has really not been diagnosed in Iowa since the 1970s. So the discussion is, why is nitrate a problem if we don't see blue baby syndrome? Well, there are other health outcomes that we're studying that are of interest with respect to nitrate. And this slide kind of shows how that works. Nitrate is ingested through your water, if there's nitrate in your drinking water, and in your diet, green leafy vegetables and processed meats. In the oral cavity, nitrate is reduced to nitrite by bacteria, goes into the gut where it's further reduced by amines and amides to what are known as nitrogen nitroso compounds. Those NOCs are enhanced by things like iron and inhibited by some vitamins. And so, excuse me, that's essentially how nitrate works in the body. Well, why are these nitrogen nitroso compounds or NOCs of interest with respect to human health? Well, in animal studies, about 300 NOCs have been tested, and almost 90% of them were seen to be carcinogenic in animal studies. In almost 40 animal species, including 6 species of primates. And you can see the tumors listed there that have been documented in animal studies. So with that in mind, and knowing how nitrate is endogenously transformed in the human body to these NOCs, that's why we're interested in nitrate with respect to human health. So in Iowa, we have a couple of big studies. One of them, the Iowa Women's Health Study, which is a prospective cohort study of about 44,000 women that started in 1986, funded by the National Cancer Institute. A prospective cohort study is when you enlist participants at a point in time and follow them into the future. You follow them forward. So what you do is you collect information on all kinds of potential risk factors when you enroll them. Then you follow them through time to see what kind of illnesses they may develop. So in this cohort, we have information on the source of water. Do they drink public water or private wells? How long have they been on that source? And we found that over 22,000 women were on the same source of drinking water for over 20 years, which is a really nice study population. In other words, we know that they've been on this water for a long, long period of time. We have nitrate data from our database from 1955 through 88 at that point in time, since it was 1986 when they were enrolled. So we calculated an average nitrate exposure over that 33-year period. Now with cancer, it's not necessarily what you're exposed to today, it's what you were exposed to in the past, maybe 10, maybe 20, maybe 30 years ago. That's really of interest with this type of research. We looked at nitrate in the diet, vitamin use, smoking history, and so on. We followed up the experience of the cohort through the Iowa Cancer Registry to see what kind of cancers they developed. So here's what we found. For bladder cancer, a study that we published in 2001, we found an almost threefold risk of bladder cancer for women who had over 2.5 milligrams nitrate nitrogen in their water, have been on that water supply for over 20 years. So the drinking water standard for nitrate is 10 parts per million, or micrograms per liter. And so that's quite a bit less than the drinking water standard. Followed up on that just recently, the Jones article from 2016, and found about a twofold risk of bladder cancer at over 5 milligrams per liter for women who have been drinking that water for over 4 years. Another cancer that we were looking at was ovarian cancer. In the earlier study, we found a not quite twofold risk of cancer for women who have been drinking water with about not quite 3 milligrams per liter for over 20 years. Again, followed that up, and again saw a twofold risk of ovarian cancer for women who have been drinking water with 3 parts per million nitrate nitrogen for over 11 years. So that is, well below the drinking water standard. And so that's something that is of interest, we think, with respect to nitrate. Thyroid cancer, again, that first dash is the biological plausibility, and I'll let you folks look at that while I take a drink here. Researchers found an increased risk of about 2.5-fold increased risk at over 5 milligrams per liter for women drinking that water for over 5 years. So we're seeing bladder cancer, ovarian cancer, thyroid cancer appear to be related to nitrate in the drinking water after adjusting for all the other risk factors that we were looking at. So, being that it's epidemiology, it's not everything turns out positive. Sometimes you look at the newspaper and one day it'll say, chocolate is the best thing on the planet. You should have a Hershey bar every day and you'll increase your life expectancy by 5 years. Then a week later it says, a study come out and says chocolate will kill you, right? Okay, so there are studies on nitrate that come up with no association, and they're listed here. Another study in Iowa, the Iowa Case Control Study of Cancer and Drinking Water Contaminants, which was conducted in the 80s, found no association of nitrate with colorectal cancer, with bladder cancer, with brain cancer, with pancreatic cancer, a different population also in Iowa. Okay, so what we're doing now is we're still looking at nitrate. We're trying to look at mixtures. When you get a glass of water out of the tap, at least here in the Midwest, there's some nitrate, there might be a little atrazine, there's certainly some disinfection byproducts. We're discovering that arsenic is becoming more of an issue because we're seeing it in some of the private wells around the state. So we're trying to look at mixtures of water to tweak out what might actually be important. And that sometimes is difficult because we may not have a whole lot of data on some of these contaminants. But it is a research that's in progress. So moving into birth defects, here's a slide that has a map of the National Birth Defects Prevention Study Centers. There are 9 or 10 states that are involved in this research. It's been going on since the early 1990s, and Iowa is one of the states that's involved in that. So the National Birth Defects Prevention Study is an NIEHS-funded study of mother's lifestyle. Again, interview the moms of the babies to see what they've been exposed to. We're looking at nitrate in drinking water and in the diet, and in what are known as nitrosatable drugs, some over-the-counter drugs that are available. We looked at nitrate data for Iowa and Texas, public water supply data. We also tested bottled water in both states because a lot of people report, well, I drink some water out of the tap, but I drink bottled water at work or whatever. So we sent actually graduate students out in both Iowa and Texas to collect bottled water at various places around the state, tested that water for nitrate, and added that to the analysis. Now, the interesting thing is that bottled water is very, very low in nitrate, we found, except for spring water, which has a reasonable amount of nitrate. So in birth defects research, we're looking at the mom's exposure. In this case, we looked at the mom's exposure 1 month preconception through the first trimester of pregnancy only. As I mentioned earlier, for cancer, it's decades and decades of data that we're trying to figure out what the exposure is over that period of time. For a pregnancy, it's 1 month preconception through the pregnancy. For the outcomes we were looking at in this study was just through the first trimester. So we geocoded the mom's residence during that time frame, B1, through pregnancy, first 3 months, and linked it to public water supply data that we had. We did have water consumption information for home and at work, and we had information on water filter use. So here are the results from that study, just published a couple, 3 years ago. Moms of babies with spina bifida were twice as likely to ingest more than 5 milligrams nitrate daily from drinking water than were control moms. Now, this is not 5 milligrams per liter nitrate in the water. This is the contribution of water to the body burden of nitrate. So 5 milligrams nitrate from the drinking water. We also found that moms of babies with limb deficiencies and moms of babies with cleft palate were not quite 2 times as likely to ingest about 5.5 milligrams nitrate daily from their drinking water. So again, here's a connection of nitrate in the drinking water after adjusting for a variety of other risk factors and the risk for some of these birth defects. Other drinking water nitrate studies also report positive association with neural tube defects. Spina bifida is a neural tube defect. Positive studies in Canada, California, and Texas have been reported. So we're just going to kind of jump quickly through some of these other contaminants that we've been looking at. Water disinfection byproducts, of course, mostly with surface water, treating surface water with chlorine and chloramines and other compounds to make the microbiological effect nil, so you're not exposed to bacteria and so on. We do have a lot of data on trihalomethanes and haloacetic acids. Those compounds have been shown to be carcinogenic and teratogenic, or potentially causing birth defects in animal studies. And there's the EPA drinking water standard for total THM and total HAA is listed there. So Iowa studies, again, a study from 1992 showed a not quite 2-fold increased risk of intrauterine growth retardation, which is low weight for gestational age, for women who were drinking water with chloroform at over 10 ppb. We also saw an increased risk of a study conducted by Ken Cantor at the National Cancer Institute, an increased risk for bladder and rectal cancers for people who had longer duration on a chlorinated surface water source. Of course, that's a very gross categorization, but at that point in time, it was about the best thing we could do with respect to exposure to chlorinated surface water. The Iowa Women's Health Study saw no association of total trihalomethanes with either bladder cancer or ovarian cancer. Looking at atrazine. Atrazine is the one pesticide that we have a lot of data on in Iowa. Here's a map, a USGS map actually, that shows atrazine use. I think this was, this is back in the early 2010s, 2010, 2011, 2012, that time frame. And the red on the map is average annual use of over 34.5 pounds per square mile. So you can see the corn belt there. Iowa is almost all red. Illinois, Indiana, into Ohio kind of stretches up into Minnesota. Lots and lots and lots of atrazine use, mainly on corn. So exposure to atrazine in drinking water. Again, here's some information on our use in Iowa. A total of about 6.7 million pounds were applied over 7.8 million corn acres in 2014. About 8% of the private well water samples in Iowa have detectable atrazine, as do the public water samples in Iowa. So the desethylatrazine, a degradate of atrazine, in a study conducted in 2006 to 2008, we found about 11% of the wells had desethylatrazine in them. Drinking water standard of 3 parts per billion, again, a possible human carcinogen. So the studies in Iowa looking at atrazine in drinking water exposures, the Iowa Women's Health Study saw no association with ovarian cancer risk. A study conducted back in the 1990s by Ron Munger in southern Iowa. RAFBN is a rural water association that provides drinking water for the bottom 2 tiers of counties in Iowa and some counties in northern Missouri as well. Munger found that the RAFBN communities had a higher risk of that IUGR, intrauterine growth retardation, low weight for gestational age, associated with atrazine and cyanazine in the drinking water. A recent article that came out of the National Birth Defects Prevention Study found that atrazine was not associated with a risk for hypospadias in that population. Arsenic. As we know, arsenic is naturally occurring, and it's kind of dependent on geologic conditions, subsurface chemistry, and well use in the private well population. Drinking water standard, EPA drinking water standard is 10 parts per billion. I think that came into effect in 2006. Previously, it was 50 parts per billion. And the health concerns from exposure to drinking water, and this is from, the cancer studies are mainly from Southeast Asia, where they have lots and lots and lots of arsenic in their groundwater, very high levels of arsenic, things like lung cancer, bladder cancer, skin cancer, some cardiovascular disease has been associated with arsenic exposure. So what we've done in Iowa is mainly related to surveillance. In 2002, 2003, a study that was conducted by our center in collaboration with IDNR and IDPH, I believe USGS was involved in this study. We looked at about 230 wells in 54 incorporated communities that do not have public water supplies, and so everybody's on a private well. And we found that about 23% of those wells had arsenic detected, and about 5% had arsenic over the drinking water standard of 10. At that time, the drinking water standard was 50, but we're looking at it as 10 now. Following that up in 2006 to 2008, the Iowa Statewide Rural Well Water Survey, Phase 2, the first phase was in the late 80s. We looked at about 475 wells in 91 counties total. Almost half of those wells had arsenic detected. About 8% had arsenic over the drinking water standard of 10. Again, private wells aren't regulated, so it's not a problem except for the well owner that has to deal with it. One of the main things we found, the most interesting thing we found, was that while we were thinking that arsenic was a problem in the north central part of the state, in the Des Moines Lobe area, we found that 31 counties across the state had high arsenic detections in some of their private wells, and they were kind of randomly, those counties are randomly distributed around the state. So we thought, looking at that arsenic is a red flag with respect to public health. So some things were talked about on the state level. One of the best things that came out of the research, the surveillance project that we're talking about here, is that the state's Grants to Counties program, which provides free testing for public water, or for private wells for nitrate and bacteria, added arsenic to that program. So now there's free testing for arsenic as well. So that was a very positive thing. Also, there's up in north central Iowa, Cerro Gordo County, which is in the area that we consider to be have problems with high arsenic in the groundwater. They have a very nice program of educational outreach for arsenic. Here's a billboard in Mason City, Iowa, which is up there, asking you, arsenic, get your well water tested, come to our website, we'll help you get your well water tested. They also did a blanket postcard mailing to every private well owner in the county about arsenic. It's been a very positive thing, and there are other things, other outreach activities going on with arsenic right now in Iowa. We think we really have done, the State Health Department and some of the counties have done a really nice job with getting organized to deal with arsenic in groundwater. Okay, harmful algal blooms. This is an emerging issue. You can read through this. Some of the problems. Microcystin is something that we're having problems with in Iowa, not only from recreational use, but also the drinking water source. Des Moines Water Works, which provides drinking water for almost 500,000 people in the central part of the state, is seeing microcystin in their source water, the Raccoon River. So that is something that is an emerging issue that needs to be dealt with. Recreational water exposures, just real quickly, we did what we call the Iowa Beach Study, and yes, we do have beaches in Iowa. In Johnson County, where we're located, we found, did some surveying of beachgoers and found correlations, self-reported skin rash, microcystin and skin rash, positive correlations. So it's becoming more and more of an issue for recreational exposures here in the Midwest. Neonicotinoid insecticides, and I just want to get through the rest of this really quickly so Ann can give her talk. We're seeing the very last bullet, I guess it's not the last one, the last bullet shouldn't be there. A 2013 USGS survey detected these neonics at all 9 sampling sites in Iowa. So it's something that we're becoming more concerned about with respect to drinking water, source water. Pharmaceuticals, again, pharmaceutical compounds, the USGS surveillance activities, looking at it in Iowa and across the U.S. Problem here is that depending on how you dispose of your unused drugs, and also just from wastewater treatment doesn't take out some of these compounds, goes out in the wastewater effluent into the surface water source. If that surface water source is used downstream as a drinking water source, you could get some of those compounds in there at very trace levels. Conventional drinking water treatment may not remove those compounds, so that could be a problem. Okay, so implications for source water protection, at least in Iowa. I mentioned the Des Moines Water Works provides water for about 500,000 customers. Nitrate in the Raccoon River is a huge problem. There's a lawsuit you may have heard about that's going through the courts right now. The Des Moines Water Works is suing 3 counties upstream because of the nitrate loads that are coming down the river from those counties to Des Moines. They have to remove that. It's a very expensive removal process. They have a reverse osmosis system, which costs a lot to run. Again, Microcystin is becoming a problem with groundwater sources, arsenic, and we're looking at radionuclides now in terms of what kind of levels of those contaminants might be in the groundwater. The water quality debate, who's to blame? How do we fix it? There's lots of different approaches going on. The Iowa Nutrient Reduction Strategy is something that's coming out of Iowa State University and the Iowa Department of Ag and Land Stewardship. There's another approach, the Iowa Watershed Approach. Lots and lots of ideas, essentially no money, with any of these ideas. And so we'll see what happens. And the IDNR's new monitoring strategy just came out a couple of weeks ago. There's lots of good things going on with water monitoring. Again, it's all budget driven. So some of the things that would be good to do may or may not be done because of not enough money to take care of that type of thing. So with that, I'm going to say thank you very much. Here are the collaborators that are involved in the research that we do.
So I work for the Iowa Environmental Council, and we are a nonprofit alliance of over 70 diverse organizations and businesses and individuals. Our mission is to advocate for a safe, healthy environment and sustainable future for Iowa. We're about 20 years old, and we're also a member of a number of regional and national coalitions that work together on water and land issues and energy issues. We try to be balanced, results-oriented, science and information-based as we advocate for a cleaner, healthier Iowa at the legislature, with rulemaking agencies, and when necessary, in the courts. And we've been very supportive and involved with trying to make sure that Iowa has a variety of strong water monitoring activities going on, both by professionals, and we have been a strong advocate for the Iowa Water volunteer monitoring program since its beginning, that some of you may be aware of. So I'm really going to focus on the report that we did this year, looking at nitrate in drinking water. And as you have gathered probably from Dr. Wyer's presentation, we feel like this is a public health concern for all Iowans. We decided to do this study because we were going to more and more meetings where the question came up, often, virtually always, from ag interests, saying, when was the last time you heard of a blue baby? Do we really need to even be that concerned about our nitrate levels and our state waterways and drinking water. And maybe the drinking water standard is too stringent. So as many of you are very aware, and as Peter alluded to, we have the drinking water standard of 10 milligrams per liter, established in the 1960s, not just in this country, but in many countries around the world, to prevent methemoglobinemia, or blue baby syndrome. And newborns up to 3 months old are especially vulnerable. But this syndrome is rare, since the health standard was established. And so, we thought, well, possibly that question of, maybe our drinking water standards are too stringent was at least a fair one to consider. Since the acute toxicity levels to children, as far as we know, are linked to levels, upwards of 22, 25, even, around 40 milligrams per liter. But we were aware that vaguely that there might be other health concerns related to nitrate and drinking water, but nobody talked very much about them or talked about them hardly at all. And so we started to find out what the research is, ask questions of health experts, and very quickly realized that it was complicated. There are a lot of multiple issues identified, as Peter talked about. It's complicated. There are many influences, and certainly synergistic effects may exacerbate adverse outcomes with pesticides, but also even with bacteria. And people have different responses. Not only that, the nitrogen cycle is complex. Is it even really nitrates? However, again, nitrates are quickly converted within the body to nitrite and other compounds that are widely considered to cause cancer and other health problems. So our conclusion, after spending months looking into this and communicating with health experts like Dr. Weyer, is that yes, indeed, nitrates are linked to many health concerns. We found extensive research investigating health concerns in animal and human studies. However, many of the possible concerns were represented by limited studies. Definitely more research needs to be done because even sometimes these findings conflicted. Maybe the research was conducted in different ways on different types of populations. And so we need to learn more for sure. We focused on the most widely supported research results that were found strong associations in multiple studies, often over many years. And as a result, the issues that we report on are the birth defects concerns, bladder cancer, and thyroid cancer. And I'm not going to go into detail on those at all. Peter alluded to, reviewed many of them. A lot of the research has been done in Iowa thanks to CHEEK, but we also include research from around the country and around the world. One thing that we really wanted to show by the time we were done with this is to help people understand that in Iowa and probably many other states, this is not just a problem with our largest drinking water supply. There's been a lot of attention to the Des Moines Water Works in central Iowa because of the lawsuit that takes issue with some of the rules that regulate or don't regulate tile drainage in, very intense agricultural areas. However, these are problems around our state. We found that there were 16 maximum contaminant level violations of nitrate at 10 public water supplies in 2015, the most recent year that we have data for. This does represent a drop in violations since 2006, when we had 64 violations at 19 public water supplies, so that's good. However, currently 39 municipal systems in Iowa are considered highly susceptible based on finished water nitrate levels above 5 milligrams per liter and rising. And one thing we really want to point out is that the decreasing violations over the last decade are due to treatment or source water replacement. It's not because research is showing that the nitrate levels are decreasing in our waterways or groundwater, although the trends look like maybe they were going down a little bit, and now the last 5 or 6 years they're going up again. So we also want to put this in context, that this isn't, you know, the drinking water standards is one of our most obvious problems here, but our nutrient reduction strategies in Iowa and the Midwest came really because of the Midwest levels of nitrogen and phosphorus fueling the dead zone in the Gulf of Mexico. And then, as Peter talked about, we also have nutrient pollution that's leading to toxic blue-green algae blooms, causing beach advisories and having serious economic impacts on our local economies, because people just don't want to go to those beaches and those parks and recreate anymore. And this is likely to be even a greater concern because our level for health advisory level for microcystin that is based on those advisories in Iowa is 20 micrograms per liter, and in December the Environmental Protection Agency, as you may be aware, is recommending that the level be 4 micrograms per liter based on new health impact information. And so that's really worth flagging, I think, for folks who are involved in monitoring. And then also, nitrate is harmful to sensitive aquatic organisms at 5 milligrams per liter or higher, or maybe with some very sensitive organisms, even at lower levels. And we can do better. We're starting to make progress with the nutrient reduction strategy here in our state, and you know, I hope that you are in some other states as well. But we need to do a lot more. We need sustainable funding to address our nutrient pollution issues more systematically. We need to strengthen implementation of those nutrient reduction efforts to include an expanded integrated watershed approach that will include monitoring to guide adaptive management, and that's something that the Iowa Environmental Council has advocated for a long time and we feel strongly about. We need good information. Eventually, you know, will the voluntary approach take care of all of our problems? Some of us suspect that may not be the case, and that we will need basic standards of care expected from all landowners. But in the meantime, we want to say that we could probably do a lot more to activate the power, our own power as consumers, to support farmers practicing good stewardship. And that can include buying local, if you know the farmer, and also buying certified organic products. Cleaner water brings multiple benefits. This is not just about improving health. It's also about strengthening local economies. Many of the practices that will improve our water quality will also reduce potential for flooding, and just in general, make our communities more attractive places to live, to raise families, to recreate and retire, and make us all likely to be, giving us all a better chance to be healthy. Thank you again. If you want to find out more and get our full report, you can find that on our webpage, and I'll give you a simpler URL in a minute, but you can also find it under our Land and Water and Land publications. And I really want to thank multiple reviewers that we worked with and took many, many comments and made many changes to try to make sure that we were credible in this report, and appreciate the help from Dr. Weyer and Cheek, also from the Iowa Public Health Association, the State Hygienics Lab, the University of Iowa, county health departments here, and others. Thank you again. Here's my email if you would want to contact me, and our website to get more information. And that's all. I look forward to any questions.